choosing the vertical. If we're scanning a patient and we're restoring them at the same vertical that they have, it's easy. You just scan their teeth and they're biting down when you take their bite. But if we're doing anything that opens their bite, so whether that's a night guards, we're opening their bite. We're doing crown and bridge where we're changing the vertical. They're worn down and we're actually opening them. We have to scan them at an open vertical. There's a lot of ways to do this. For us, for a night guard, we scan their upper, scan their lower, we throw 2 retractors in there. Patient holds the retractors like this. We take a leaf gauge. We put it in between their front teeth. We control the number of leaves to control that vertical where we feel that that's appropriate. And then they're pulling out their cheeks and they're holding a vertical with their front teeth or the leaf gauge, and then we scan and scan. Now, I like if I'm doing an actual rehab of some sort, hybrids, crown and bridge, you name it, I like using composite stops because you can step back and evaluate the situation. So this patient, we prepped every tooth in the mouth for crowns, and we opened her up, and in that first appointment, it's all about that diagnosis about that vertical. And I had originally put some composite in there on her premolars, no etch, no bond, just kind of smush them up there and have her bite into it. And she bit down and was like, way too open. You know, I said, close your lips over it. She's too open. Okay, I instantly could tell that my vertical was overbuilt. And I caught that. So we take it, we shave it down, we reduce it, and next thing it's bite down, you know, you smile, and the facial structures look appropriate. And I said, good, that's my vertical. With those 2 little composite bumps, I did that before I scanned, before I CBCT'd, before I photographed, and I locked her in. So now she gets scanned in our intraoral scanner with the composite stops. She gets scanned in the CBCT with the composite stops, and then she goes to the photo studio before she walks out, and she gets her photos with the composite stops. So that every record that we took locked her vertical. And that's super important because we want to plan with that vertical, we want to scan, we want to merge the files, and composite is a really good way just to lock them into something. So this has worked well in my hands. There's obviously like a ton of different ways to do this.